Good afternoon, everyone. I in the chat box as we begin today's session. Good afternoon. I want to believe everyone can hear me. We would like to begin today's session. My name is Kevin Hiohu from the National AIDS Control Council. And today's session is on some key highlights from last year's ICASA conference. And the theme of the conference was Africa Ending AIDS Delivering Differently. Today's speaker is Jane Ng'ang'a from Kenerella, but she's going to introduce herself a bit better and tell us a bit more about herself. We were also to be joined by Rose Kaberia, but due to some unavoidable circumstances, she will not be joining us today. So we will only have a sole speaker, and that is Jane Ng'ang'a. So Jane, if you can hear me, please take it away. I think we have a good number of participants, and I believe more will be joining us as we proceed. So Jane, please take it away.
Okay. Good afternoon, and thank you, Kevin. I'm glad to be facilitating this session. My name, as has been said, is Jane Ng'ang'a. I am the National Coordinator of the Kenya Network of Religious Leaders Living with or Personally Affected by HIV, a platform that engages faith communities on HIV issues. And I also participate in the faith sector working group. As Kevin has said, we were to co-facilitate this session, but my colleague, due to unavoidable circumstances, she's not able to join us. So I will be taking through some of the key highlights from the ICASA conference, which happened in December. And online, I can see a number of people who are also part of the participants. And I believe we'll have a good discussion, especially looking at what is it can we adopt as a country, which was an outcome of this conference. So I'll start off by looking at the conference overview in terms of the attendance, who was there, and how many people. So we had over 4,000 delegates, which were drawn from about 125 countries. And the representation was broad from governments, from leading scientists. We had researchers, policymakers. We also had programmers, activists, people living with HIV, as well as various representatives from the civil society organizations. During the first session, we had opening remarks from the President of the Republic of Cote d'Ivoire, Mr. Olassène. And after he had made his remarks, he was flanked by the Society for AIDS in Africa head. And then we had the key dignitaries like UNAIDS Executive Director, Michael Sidibe, making remarks. And we also had other ministers from the Republic of Cote d'Ivoire and others from around the world. The key objectives of the ICASA conference 2017 were, one of them was to promote innovation, partnerships to increase domestic investments to achieve the 1990 targets. The second one was to look at how integration can be made for sustainable responses towards ending AIDS, TB, hepatitis, and associated diseases. The other one was to look at how we can translate science into action in order to maximize program impact. The other one was to provide a platform to maintain and sustain investment for civil society organizations as well as faith-based organizations. And the last objective was to provide a platform to promote rights-based models to overcome universal access. In terms of delegates' contribution towards the ICASA conference, there were a total number of 2,000 abstracts which were presented. Some of them were posters, and others were oral presentations, which were about 800 of them. There were 6 plenary sessions. We had 87 satellite symposiums. We had 17 workshops. We had 13 special sessions held. And then we had 28 abstract-driven sessions. And then we had 11 non-abstract-driven sessions. And out of this, Kenya had its share. We participated heavily. We had approximately 60 people attending the conference. And we had different activities. And I think just highlight 2 or 3 key activities that Kenya participated in. One of them was demonstration of the Kenya HIV situation room, which is usually a dashboard that collates all data from the different M&E subsystems and present it in different graphics to allow for decision making. There was also a satellite symposium on implementing partners notification services in community and facility settings, which was done by WHO, LVCT, and the Center for Disease Control in Kenya. We also had quite a number of the participants doing abstract presentations, both oral and posters, and there was also participation in the community global village. I'll take a few minutes to look at the key highlights from the opening remarks, which is one of the sessions that set the stage for the conference and for the conversations within the conference. One of the key highlights was a call for country leadership to take up the political and social unrest so that does not threaten the many achievements that are made in the AIDS response. And it was noted that there is a lot of political unrest within Africa that could bring a halt to some of the achievements that have been made or are continuing being made to date. The other key highlight was the need to prioritize prevention for women and adolescents from HIV. Women are still heavily affected by HIV, and there is a need to have a key focus on that. The third one, to ensure more space for civil society due to civil society's huge contribution in the AIDS response. The fourth one, the need to increase overall investments in research to improve the quality of life for people living with HIV, and especially within the African setting. Research or investment in research was noted as something that needs greater emphasis because we know that Sub-Saharan Africa, we are heavily affected by HIV. The other key highlight was the need to sustain the great achievements in the AIDS response that have been made this far by individual governments and also cooperatively within Africa. There was also a call for innovation so that we can bring the pandemic to an end, and that innovation needs to bring action now and also acting differently. So there was an emphasis of not doing business as usual, but looking at ways where innovation can be integrated in the interventions so that we can have a greater impact. There was also a call on governments and all to realize that health is a right and ending AIDS is the duty of everyone. So having looked at the key highlights from the key presenters during the opening remarks, we look at some of the key highlights from the conference, from the various plenaries that were held. and some of the discussions that came out. So one of the issues that was raised heavily was the need to focus on integration of people with disability. The other one, the emphasis on moving from behavior change communication to ensuring that action is being taken, because I think there is a focus on only behavior change communication, but the monitoring and ensuring that action has been taken and sustained, that's still an area that needs a lot of emphasis. Need to increase HTC uptake was also pointed out. We still have so many people who do not know their HIV status or need to reconfirm their HIV status. The need also to continue in education events to ensure that the knowledge on HIV is being given to the community. The second cluster of the key highlights from the conference was focusing on leadership program, and there was an emphasis on commitment and engagement by government ministries and all the key players within the various sectors. And then there was also a focus on resource mobilization as part of the leadership program. There's need to focus on resource mobilization, both at country level and also at the global level. The third key highlight is the need for commitment, and there was a call for renewal of political commitment, both at the African Union level, but also at country level and at community level. The need also to strengthen health systems by governments. The need to establish ARV manufacturing plants to cover the sub-region by 2018. There was also the focus on using the platform for the Organization of African First Ladies Against HIV and AIDS platform to ensure that the role of sustaining the HIV response, is given a lift or some level of support from that platform. Also the focus on launch of continent campaign for pediatric AIDS in 2018 by the Organization of African First Ladies. Also focus on committing to elimination of mother-to-child transmission, and also a focus on family planning. That the 5 roles we can utilize the Organization of First Ladies platform to ensure that we are gaining milestones by engaging them. The other key highlight was on engagement of youth. And one of the key issues that came up was the need to continually engage young people in advocacy, especially on various issues that are affecting them, from prevention to ARVs and other issues affecting young people, sexual and reproductive health rights and such. There was also the emphasis on integrating young people in HIV programs and other programs that affect them, from planning to implementation to monitoring and ensuring that they are, at the center stage, but also there's also the integration of those services in other services that are affecting young people. The need to encourage the culture of accountability for young people was also emphasized, and the need to continue focusing on youth-friendly services. The other key issue was focusing on resources or resourcing for HIV, and some of the key highlights were HIV financing advocacy, that needs to continue being given emphasis. Domestic financing for health needs also to be at the center stage for governments or different countries. Enhancing public-private partnerships was also given a lot of emphasis, and to just look at how we can create synergy by having PPPs. Coordination was the other issue to achieve Agenda 2063 was also given a lot of emphasis. And the fourth one, developing regional community observatories to ensure that there is proper monitoring, and there is also accountability mechanisms being set up at both at the community level, at the regional level. There were many cross-cutting issues that came up. One of them is the need to put people living with HIV at the center of treatment, care, and access interventions. There is also need to develop differentiated care models that fit different categories of people living with HIV, and ensuring that they are participating in such. The need to ensure quality of data that is coming through the various monitoring systems that we have, that is up to date, and it's also quality. The need to have well-trained healthcare workers was also emphasized. Need to address stigma and discrimination. It's still a challenge among people living with HIV and in different communities. The need for innovation, especially when forging partnerships for male engagement. We still have male involvement as a key challenge, I think, in Kenya and also in other parts of Africa, and therefore there was a call for innovation. How can we ensure that we are reaching out to men and in a way that would also sustain them in the various HIV services? The other issue was around research and innovation for development of more adequate ARV and also pediatric formulations. And then the last one was an emphasis on an integrated approach to service delivery, so that we do not have different services being offered on the same person at different points. So an integrated approach that would allow service delivery to be at one point. I'll take a few more minutes to look at some of the key highlights from the different tracks. As you know, we had different tracks focusing on different issues, and track A was focusing on basic science, biology, and pathogenesis. I'll just highlight of the key recommendations that came out of the conference. So under track A, there was a recommendation around the first 90, which focuses on testing. And one of the key recommendations was increase new strategies for HTS or HIV services, testing services. The second one was the implementation of strategies. According to the World Health Organization, there are so many, these are strategies that have been brought across by the World Health Organizations focusing on testing. The need to ensure they're implemented. The third one, the need to increase testing for MTCT or mother-to-child transmission programs, screening of other pathogens, hepatitis B, syphilis, to be also integrated in the testing campaign. Then the emphasis on early infant diagnosis was also emphasized as one of the recommendations that need to go with the first 90. Still under track A, there were some recommendations given on or focusing on viral load and resistance issues. Under viral load, there was need to scale up. Of course, it's part of, it's the third 90. There's need to scale up viral load testing. There's also need to have network to map all mechanisms for comprehensive assessment. The need for viral load as a biological test was also given as a of paramount importance. In terms of resistance, there were key recommendations given that would address the issue of resistance. One, increase in resistance for ART patients. There's also the issue around nucleoside inhibitors, emergence of mutants for ARVs, need to increase surveillance for resistance so that it can be established why resistance is happening. The need to have sensitivity of protease inhibitors affected as an area of research. The need also to look at the second line patient, some of the challenges that they're experiencing. And then related to those is also access to viral load testing services. And there's also the issue of early detection. Under the same track A, there were recommendations given around technologies and maintenance. Under technologies, they need to look at several other instruments that are available in the market that can be used. They need to have more sensitive genotypes, need to integrate high technology innovation in providing testing services. In terms of maintenance, there is need to sustain mechanisms in place and ensuring that the technologies or the various testing or instruments being used are well maintained. They need to train biomedical engineers, policies to be set in place that can establish institutes for training and maintenance of devices. So to have policies that would lead to the establishment of training institutes was also a recommendation that was given. Under track B, there were a number of recommendations, and track B focuses on clinical science, treatment, and care. So in terms of care innovations that would optimize care and treatment services, some of the evidence-based interventions that have been put in place and seen to work, one of them was the mentor mothers, and therefore I need to focus on mentor mother programs, male partner involvement, community empowerment, enhance psychological and emotional support for people living with HIV. They need to have a family approach for HIV index testing, and then integration of care in One Health approach. So these were some of the recommendations that were given under track B. Then there were also under track B some of the comorbidities, HIV comorbidities that were also discussed, and one of them is TB. And some of the key recommendations that were given were: one, for prevention, there is need to scale up use of IPT to reduce incidence and mortality. Number two, the issue of diagnosis, that we need more sensitive TB testing diagnosis. Under treatment, the need to use the World Health Organization fixed dose combination drugs. And then number four, need to have short treatment regime to reduce resistance to TB. And then the last one, the need to have active pharmacovigilance, that word. Then there was also recommendations given that would lead to ending TB. And one of them was to increase access to treatment for TB patients. Then the inadequate infrastructure for integration. So we need to look at how do we ensure there is integration of TB services due to the inadequacy of infrastructure for TB treatment. How can we leverage on the existing infrastructure to ensure that TB patients are getting the necessary support? Then we also need to address the lack of motivation for healthcare workers who have been focusing on TB issues, so that we can continue enhancing case detection for TB and also ensuring there is follow-up in terms of treatment. we need to strengthen coordination for TB HIV programming. And then a very important also aspect is to look at community engagement. How do we ensure that the communities are also at the forefront in dealing with TB issues, just the way we've had communities engage in HIV-related issues? And then the issue of financing and ensuring that there is also financing for HIV, which is also sustainable. The other HIV comorbidities that were also discussed were STIs, or sexually transmitted diseases, and non-communicable diseases. Under sexually transmitted diseases, there were 3 key recommendations given. One of them is that sexually transmitted diseases are still prevalent, and therefore we should not lax in terms of diagnosing them and ensuring that there is also information being given to the communities. Number 2, the need to strengthen STD monitoring at the facility levels. Number 3, revision of national guidelines to incorporate actual bacterial resistance profiles concept. So that was also another recommendation that was given. Under non-communicable diseases, there were 2 recommendations given. Systematic screening, and this to be integrated with other services that are being provided for people living with HIV. And then decentralization of medical specialists who can deal with such issues even at the local level. That was also given a lot of emphasis. Track C focused on epidemiology and prevention science, and a number of issues came up. One of them is around just a second. Hepatitis B vaccine and voluntary male medical circumcision. And one of the recommendations that was given is that we need hepatitis B birth dose vaccine to be given to children. Then we also need community involvement to support voluntary male medical circumcision. So that should be at the center of the community to ensure that medical male circumcision is happening. Then need to have outreach activities which should be age specific, so that we are reaching to the right categories of people with the right messages. Under track C, there were recommendations given under prevention of mother-to-child transmission. One of them, support groups are still key at the community level, and therefore we need to enhance and support groups for people living with HIV. The other recommendation is to encourage partner involvement in the whole process, so that when information is given, it reaches to both, and they are working together. And then they also need to focus on some of the new findings. For example, the dual HIV and syphilis testing kits, which are available. So utilizing such to ensure that testing services are available. Under track C, there were recommendations given focusing on key populations. And one of them, there was an observation that there is lack of knowledge among students within this cluster of key populations, and therefore need to ensure that information is being disseminated. There is also a lot of gender-based violence happening, especially among sex workers, and there is need to ensure that that is addressed. Men who have sex with men have relations also with women, and therefore there is need to have consistent messaging around condom use. and ensuring that that message is given consistently. Then integrate male sex buyers and also gatekeepers. That was also given as a recommendation. There is a need to integrate such. Track D focused on law, human rights, social sciences, and political sciences. And a lot of recommendations were given. But some of the key highlights were: one, a focus on stigma and discrimination. There's also a need to focus on discriminatory laws at country levels and ensure that such are dealt with. They need to focus on sexual and gender-based violence. And there was an emphasis when that is being addressed to also ensure there is focus on the LGBT community. The fourth one was focusing on the key populations to be involved in drafting laws, which would ensure a focus on tolerance and also issues of exclusion that are affecting them so that they are able to frame them in the right way. They need to establish frameworks on negotiation. The emphasis to be given on champions so that they can be at the forefront in confronting some of the challenges that are being faced by the community. Contribution from religious community was also seen as a key area of focus that cannot be ignored. And then I need to address sociocultural and HIV determinants. For example, pre-exposure prophylaxis to be used among discordant couples. And as that is happening, also looking at what are those sociocultural and HIV determinants that need to be addressed. Then they need to have young people as ambassadors for sexual and reproductive health and rights, so that they are able to reach out to other young people and be able to also engage in advocacy. And then also a focus on prisons, so that we're ensuring that their rights are also protected. Their rights to health is also protected. Under track D, there was also a focus on social knowledge and mass communication. And some key recommendations that were given was: one, the need to train healthcare workers on LGBT issues in order that they can support communities to reduce stigma and discrimination and ensure there is increase in access to services, especially for sex workers and people living with HIV. Because where stigma prevails, then people feel like they don't want to go and take up services. The second one, they need to continue engaging in training, need to address legal favorable environments to protect key populations, and then also discrimination among people living with disability also needs to be addressed. And then the distribution of condoms in prisons is also an issue that was given recommendation. Then track E focused on health systems, economics, and implementation science, and there were key highlights that were given or recommendations. One is the need to do more with less, and therefore, calling for accountability and ensuring innovation so that a lot can be done even with limited resources. The need to have innovation approaches and differentiated service delivery models at the community level. Increased political commitment and domestic financing was also emphasized. Multiple approaches to improve health financing to be utilized at the country levels. The other one was focusing on building country capacities on innovation, on innovative sources of funding. Then the other one the use of data. How are we utilizing the data that we are receiving so that it can inform approaches, and it can also be used also to get either domestic funding or also funding at the international level. And the last one will focus on the capacity building of healthcare workers. Then I'll just now look at some of the key highlights or recommendations that were given from the conference. And one of them is the need to intensify actions to involve all communities. So ensure that everyone is on board and everyone is engaged. And there was an emphasis to ensure that key populations are also at the center stage. The need to empower adolescents, girls, and young women, and they need to be involved from policy formulation to programming and also to monitoring some of the programs that they're involved in. The other one is to enhance advocacy for increased domestic funding for health. And I believe this is something that we can continually engage in as a country, both at the national level and also at the county level. The other one was countries need to honor commitments made, such as Abuja Declaration. Therefore, we need to continually hold our governments accountable to some of those commitments that they have committed to. Then there is need to scale up differentiated healthcare and ensure that different models are used by different communities. Then the other one was around building diagnostic capacity of laboratories. So that was also given a lot of emphasis. Then TB testing for people living with HIV. Promote STI screening within Africa. Then to focus on hepatitis B vaccine for babies so that we can reduce transmission in infants. Having consultative frameworks for key populations such as men who have sex with men, so that some of the challenges or some of the issues that are leading to infections can be addressed. And then the other recommendation was around addressing stigma and discrimination, sustaining awareness of communities, including the young people, the need for sustainable support from African Union leaders with regard to addressing HIV within the continent. So in conclusion, that was some of the key highlights that we picked from the conference. And then the closing ceremony was done by the Vice President of the Republic of Cote d'Ivoire, and the next ICASA conference will be held in Rwanda, in our neighborhood. So thank you so much for listening to me. We can now have a few minutes for questions, if there are any.
Thank you very much. For your presentation. Quite informative, a very good summary of the proceedings of the ICASA 2017. We'll not be taking questions. If you have a question or a comment, you can just type it in the chat box. Questions, and Jin will be handling them.
I think there are some key issues that are coming up, which we could pick up as a country. Thank you, Brian Okia. And he's saying that the issue of establishing a commodity manufacturing farm is critical, and I believe the 7.5 billion shillings pharmaceutical plant in Athi River by Square Pharmaceutical Limited becomes a reality. This is one of the flagships in the MTP3, and I think that's quite a good thing which we can leverage on, and we need to, I think, constantly engage and find out who is doing what and where are we as a country, so that we can see the realization of some of these recommendations that were given. Okay. There is a question by Andrita Ikahu, and Andrita is asking, is Kenya taking forward all the recommendations, or there are set priorities? I believe this is a conversation we can have to really look at what can we pick up as a country, because I know it would be difficult to pick up everything and implement, but we may need such a point or meeting where we come together and ask ourselves, among all these recommendations, which ones are feasible, which ones are we able to pick as a country and run with. And I believe that way we will be able to find value in having participated or having picked some of these issues from the ICASA conference. Okay, there's another question from Brian, and thank you all for the good comments, and thank you, Frida Muinde, for your comments. Washington Olo, thank you for your comment. There's also another question from Brian, and he's asking, I am glad that people living with disability was emphasized at the conference, and I would be happy to hear about the best approach to use when we engage this constituency, which we seem to be leaving behind. Era of gods, charity approach, medical approach, social approach, or human rights approach? And I think that's a great question. And there are a few comments which are being given. Thank you, Washington Olo, for your comment. And you're saying integration of persons with disabilities in HIV programming should also stand out. And I think we can have different approaches to ensure that people living with disability are involved. I think from policy formulation to implementation of the various programs, and ensuring that we are empowering people with disability. Because if we use the charity approach and all these traditional methods, I think we will be disempowering them. But we need to look at approaches that can ensure their human rights are protected, they're accessing medical services, they are also being involved in policy formulations, so that they are able to articulate in terms of policies what would work. We cannot point out to say it is one approach. I think there are different approaches that we can engage, and of course in Kenya we have organizations of people living with disabilities which we can engage to really look at how best can we be able to provide the necessary support. Joseph Gatimbo, yes. we can share the summary. We'll organize with KQ so that you can have the presentation shared. You can see a comment here by Joseph. You're saying maybe it would be important to think of how to ensure Kenya presents some of the innovation approaches being done at the high level sessions in the conference. And I can't agree more, Joseph. I think we are doing quite a bit. I think we may need to ensure that we get to that space where we can showcase what we are doing, especially at the main plenary sessions. And I know NAC can take this up and see how we can showcase some of the innovation, like the situation room and other innovations that are happening.
Yeah, very true, Jane. We are looking into how we can have presenters in plenaries of the conferences, how we can have more abstracts submitted, how we can have more speakers engaged. And just to give an example, we're trying to work on how we can have more Kenyans being engaged in the upcoming IAS AIDS 2018 conference. So yeah, that's just an addition to what you've said. We do need to look into it, and we have started looking into how we can have more Kenyans showcasing Kenyan work and all these innovative approaches that we have in the country in sessions in the conferences. So Joseph, just to answer your question, yes, it is being looked into.
I think the other maybe recommendation that is coming up is that we need to look at all the recommendations that came up and see what would work for us as a country. And probably again, you and Frida maybe need to pick up this and see how either to bring people together or something so that we see what would work for us and how, so that it's not just about attending conferences, but there is also value addition to the way we are delivering the HIV response here in Kenya. Thank you, Brian. Again, you're saying, having participated in some of the abstracts, track D, it was evident that there is need for mentoring young researchers on abstracts across Africa or high-level, I think high-level studies are not being submitted for this conference. I think it's a comment. And I think that's something we need to look at as a country and see how best do we ensure that our very young researchers are being mentored and are also engaging. Again, the need, there's also a comment around looking at strategies of including people with disabilities and ensuring they are not being left behind. And I believe also even in participating in some of these high-level conferences, I think it's critical. And I know, Kevin, you will take up some of these recommendations and guide us on how best we can approach implementation. Okay. So Kelvin, over to you.
Great. Thank you very much. It's coming in or questions coming in. Thank you very much to everyone who attended this session. I hope it's been quite informative, and I hope you've taken note of some of the recommendations that you can apply in your work as we engage in this fight against HIV and AIDS. I have taken note of the email addresses for those who would like to receive the slides. I will be sending them shortly after this session. So thank you very much. I'm going to end the session. Thank you very much again, Jane, for your summary of ICASA 2017 key highlights.
Thank you, Kelvin. Thank you, everyone. It was a pleasure.
Great. Remember, if you haven't registered on the Maisha Maarifa Research Hub, kindly do so. Head on over to maishamaarifa.or.ke and register, and you'll be able to receive updates on our webinar sessions and invitations to the same. So thank you very much, everyone. Do enjoy your day. Let's end the session there.